Hello, my name is Ginger Holton. I am a physician at Yale New Haven Hospital in Connecticut, and I'd like to tell you a little bit about coronavirus, COVID-19. The virus is pretty rapidly, as many of you know, spreading around the world right now. So what we know about the coronavirus is it's a virus that causes respiratory infection. And for some people, the symptoms are quite mild. Would remind you of having a bad cold, maybe, some cough, some mild fevers, some achy body aches. But for others, of course, we're seeing that this can lead to very severe respiratory disease. And as you know, there have been many deaths around the world. So coronavirus is a respiratory virus, like I mentioned, and so that means anytime someone who has the virus that coughs or sneezes or even breathes, droplets that have the virus are released into the air. And that is why, of course, it's spreading so rapidly. We even know that it can live on surfaces, so if someone has coughed or sneezed or been around an area, respiratory droplets can actually live for quite a few hours on some surfaces. So that's one of the reasons it's spreading so rapidly. It's pretty contagious. And there are many things that you can do to actually protect yourself from getting the virus. One of the most important things would be to frequent washing of your hands. And I'm sure this is something many of you do already, but super important after going to the bathroom, of course, but then before eating or putting anything into your mouth. So wash hands frequently, and that really helps not spread the virus quite as rapidly. Another really important thing you can do right now is just to avoid going out into public. And I know that sounds like such a bizarre thing to say, but crowded spaces, public spaces are where we're seeing really high rates of infection. We are down the road from New York City, which is currently experiencing a huge infection, and that's because people live in such close proximity to one another. So trying to stay out of public spaces and stay home is one of the most important things that you can do right now to protect yourself from catching the virus.
Hello, my name is Michelle Tucker. I am a pediatrician in Dallas, Texas, and attend the Preston Crest Church of Christ, and it's a very big privilege and honor to be in your presence. I wanted to take just a minute to explain to each of you what we are seeing with the new thing that dominates all of our conversation, the COVID-19 virus. This virus is a coronavirus. We have all had different coronaviruses before, even the common cold. Some variations of that are caused by coronaviruses, but this particular one is one that not anybody's immune system has ever seen before. Which means we don't have any immunity to it. So every person on the planet is susceptible, and it also seems to be very contagious. So those are the reasons we have taken this very seriously. The common flu, the flu that we all get every so often, our immune systems have seen those and variations of those, and so we all have better fighting chances against this. Right now, we are trying to beat the clock. We are trying to come up with both treatments and vaccines that will make it where we can manage this coronavirus before a lot of people are hurt. So that's why the extreme measures that are being taken. I'll tell you quickly what we see in the disease process. It is the main symptoms are fever over 100.4, a cough, usually a dry cough, and if you're getting worse, it usually involves a shortness of breath that's pretty significant, like you feel like you can't breathe. But here is the kind of frightening thing. We have found that quite a few people have the disease and don't even know they're sick. We'll talk more later.